Thank you, John. That was very helpful. Our next speaker and provider of brief comments is Maryn McKenna. Maryn is a journalist who has focused her efforts in public health, global health, and food policy. She has written extensively, published widely, in particular in a number of journals and media sources that we tend to see very often. Her focus in particular has been on antibiotic resistance, and I'll just mention that she is the recipient of the 2014 Leadership Award from the Alliance for the Prudent Use of Antibiotics, one of our old partners here at the forum. So, Maryn, thank you for joining us.
Thank you so much. I'm very flattered to be asked to speak to all of you. As I look around the room, I notice a number of people whom I have badgered as a journalist at various times in my career, so it's very tolerant of you. Thank you very much. It's fantastic to follow Dr. Rainford because I feel that what I have for you is a sort of qualitative in the trenches report that backs up his data. So you will all remember, of course, that 2 years ago this time we were in the end of the Ebola epidemic. And that was, to remind you, the largest epidemic in the history of that disease, killed more than 11,000 people, and was centered just in 3 countries, Sierra Leone, Liberia, and Guinea. And you'll also remember, I'm sure, that there was almost no spillover of Ebola into the United States. So by my count, there were 8 people infected in those 3 countries who came to the United States. 7 of them were medical or relief workers. 1 was a member of the media. 1 was a local resident who came to the US and infected 2 people here. Both of them healthcare workers infected in extraordinarily close circumstances. No spread to the general public, no risk to the general public in the United States. And yet, at about this time, 2 years ago, in Boston, a subway station was closed by the police because someone called 911 terrified that what they described as a Liberian woman was hemorrhaging on the platform. And in fact, she was a Haitian woman and she was throwing up. In Greenville County, South Carolina, the public school system announced it was going to screen every child in the county for Ebola before allowing them to enroll. In Hartford, Connecticut, a family had to file a lawsuit to get their 3rd grader into school because they had been on a family trip to Nigeria, which is 5 countries away from the Ebola zone. In Rochester, Minnesota, emergency medical personnel showed up to help a flu victim wearing full biohazard gear because the dispatcher couldn't tell the difference between Mali, which the CDC had warned against in a travel warning, and Somalia, where the victim came from. And finally, in Stokes County, North Carolina, the County Board of Education forced an assistant principal to stay home for a 21-day quarantine period because she had been to South Africa, which is 5,000 miles, or 1.5 times the width of the United States from the Ebola zone. So those are a few of dozens of bizarre incidents that I collected over the course of the Ebola epidemic. I collected them online. You can find them in a Tumblr called Today in Ebolanoia. These are a few more. And I'm sorry to say that they all contain the same lesson, which is not that Americans are bad at geography, though you can probably extract that from this as well. The lesson, which I think you will all recognize, is that the mass public was so alarmed by the idea of Ebola that they refused to listen to or couldn't absorb the details of how you actually contract Ebola. And therefore, they felt a perception of risk of Ebola that was orders of magnitude greater than what their actual risk here in the United States was. And they felt that risk despite every public health authority, the director of NIH, the director of the CDC, physicians in the media like Rich Besser at ABC and Seema Yasmin at the Dallas Morning News, journalists like myself with large followings, despite all of those authorities telling them that they were not at risk, or almost every authority. So it shouldn't be news to us that the general public doesn't have a solid understanding of medical processes. If they did, we would not have the persistence of trust in homeopathy. We wouldn't have the stickiness of belief that vaccines cause autism. But I see that understanding of misunderstanding of medical processes as well in the topic that I spend much of my time on, as Dr. Relman mentioned, which is antibiotic resistance. And despite decades of being asked and urged not to, we all know patients continue to pressure physicians for antibiotics, believing that antibiotics accomplish things that they don't do, and patients continue to behave in ways that are not wise around antibiotics, from not finishing prescriptions to sharing prescriptions with people whom they shouldn't. And a research project that the Wellcome Trust conducted over the past couple of years and published last year, which they based on very lengthy interviews, revealed some of the reasons that people persist in seeking antibiotics. And it was striking to me that people sought antibiotics because they felt validated more, and the validation mattered to them more than the risk of resistance. They didn't understand how resistance worked, because warnings about resistance made them feel like they were being manipulated by authorities. And I think that last point of mistrust, of feeling sensationalized, is especially important right now. The events of the election illustrated so vividly that consumers of news feel free to choose not just their own opinions, but their own facts. That was a shock to people who report on politics, but I think people in the infectious disease world could have helped them understand that, because infectious disease has struggled for years with how to present evidence so it'll be heard. So there's one point I want to make as you move into consideration of what to do about communicating risk, which is that what is in your favor is that the public loves scary diseases. It's not like you're talking to them about the rule for the waters of the United States. There are pieces of art and culture based essentially on the occurrence of plagues that have been reliable bestsellers for decades. If you go back to Boccaccio, for centuries. And plague stories satisfy very long established narratives that are sticky to people's imaginations for detection, for exploration, for heroes' journeys, for monsters under the bed. And so when we talk about diseases, the public are disposed to listen. They may be drawing the wrong conclusions, as the Wellcome's research shows. As Ebola Noya shows, they may overreact, but they are paying attention. And I think it's worth underlining that they're paying attention to people whom they believe have authority. And that may not be expertise that we would endorse. It might be Donald Trump, it might be Dr. Oz, it might be Dr. Google, but they're seeking out sources whom they believe to have a message that they need to hear. And the question, I think, is how do you move people with reliable information into the position of being listened to, so that you minimize the possibility of Ebola Noya or something like it occurring again? So that Wellcome Trust report that I mentioned, which taught me some crucial things about how people perceive resistance, had a really important point to make that I think resonates with Dr. Rainford's presentation as well. Their key point was that the essential thing for having people understand the risk of resistance specifically is to communicate to them in language that they already speak. That is not the language that we use, that you use among yourselves, or that you use when you're speaking to me and people like me. And that was a humbling lesson for me to learn, because avoiding jargon is supposed to be a core responsibility for journalists. But it's also something that all of us, and myself, I feel in particular, we all constantly fail at. Speaking in insider language is a very powerful temptation. It's very hard to resist. And I hope I can serve to remind you of that, and that you can remind each other of that as you move forward into the rest of this day and a half. Thank you very much.